Hi, Sal Perla here from Norwood Hospital. Today we're providing you an update on the coronavirus here at the hospital. At this time, the hospital in the community is seeing some form of community spread. So we have started to make changes in our plans. Last time we were speaking, we were talking about the tent and we were drilling. Things have changed now, and our tent is operational. We have all the details that can help you determine if you need to be tested and how to utilize the services here at the hospital. So first, we're going to talk about access and information. So we've been receiving numerous phone calls a day regarding information requests. So we've set up an informational hotline, and that number is 781-278-4444. If you call that number, you'll get all the information on how to get yourself educated and the next steps. If it is determined that you do require testing between you and your doctor, what we're asking for is for you to call ahead to our pre-registration phone number, and that number is 781-278-4499. And what will happen is the registrar will pre-register you, take all your information. You will be given instructions on where to go, depending on the time of the day and what services we have to offer. You could be instructed to park in the parking lot and go right to the tent, and then someone will meet you out there. Or you could be instructed to come to the hospital and wait in a isolated waiting area. In either option, we're asking the first thing you do is to put on a mask. That way you don't expose others and our staff. So that does bring us to timing for results. So at this time, it is ranging anywhere from 5 to 7 days. The laboratory that is performing these tests are in California, and there has been some restrictions with air travel, and that is slightly delaying our ability to get results quickly. The hope is that our laboratory in Marlborough, Massachusetts here will be doing the testing in about 2 weeks, and then we'll be having a much better turnaround time, anywhere from 48 to 72 hours. So we're looking forward to that, for that to happen very soon. Other changes here at the hospital, so entrances. So we are working on restricting our entrances. So the entrance at the LaRusso building with the large overhang on the front of Washington Street is now permanently closed until further notice. That leaves our Draper entrance open, which is again on Washington Street, and then our emergency main entrance, which is in the back of the building where most of the parking is. Those entrances are being staffed with individuals in the front. They will be open normal business hours. Emergency department entrance is open 24 hours a day, 7 days a week. When you come to the hospital, you will be asked why you are here, if you're feeling well, if you've done any travel to endemic areas that are being hit hard, like China, Italy, Iran, etc. We want to make sure that if you aren't feeling well or if you've been in those areas, that we ask that you not come to the hospital to visit people. Of course, if you need testing or if you're ill, we'll bring you over to the emergency department. So speaking of the emergency department, so we have made some changes there as well. Again, if you're going there for testing or for treatment and you have flu-like symptoms, we're asked, first thing is put on a mask. Our waiting area, we have made some environmental improvements. So we've turned the entire waiting area into negative pressure. So all those air exchanges in that room is being funneled out of the building. You'll see the equipment, it's kind of loud and noisy, but that's actually to protect all of you and our staff. Restrictions of visitors in general, so it depends on who you're here to see and what you're looking to do. So our maternity department at this time, for the safety of mom and the newborns, we're asking that just mom and dad be present for visiting, no children, and certainly no one with any fever or symptoms would be allowed on the unit. In general, overall, to the hospital, again, we want some common sense to apply. Right now, Governor Baker has instituted a state of emergency for the Commonwealth, and we're asking that people don't visit the hospital in general. Of course, you can, right? If someone's very sick, you can come into the building. We're going to screen you as well, but we're looking for no children to visit, and for a limitation of 1 to 2 visitors, and we're going to keep that down to an hour. And then lastly, if you are visiting someone that we call PUI, that is a person under investigation for the coronavirus, we are strictly restricting visitation closely there. Because obviously we want to stop the community spread, and going into a room that is being evaluated for PUI is not in anyone's best interest. We assure you that all the patients that are under PUI are getting great care, and we really recommend that picking up the phone and calling and speaking to them is in your best interest and the best interest of our staff and the community. Routine and elective surgery. So Governor Baker has provided additional information for elective surgery. At this time, effective Wednesday, elective surgeries are being postponed and rescheduled. We're asking that you work with your surgeon's office to accomplish a date that works for both you and the surgeon. We understand this is probably upsetting to some individuals and concerning to others. We want to make sure that people understand there's a difference between elective, emergent, and urgent. So I'll give you an example. If you are a diagnosed breast cancer patient and this ban for elective surgeries is 3 to 4 weeks, contact your surgeon. If it's urgent and you need to have that lumpectomy sooner, you and your surgeon will work together and we'll make that happen. Routine testing. So if you're coming in for a routine test, you will be screened at the door to make sure you don't have any symptoms or have recently traveled to those endemic areas, and we will escort you to your appointment to get you in and out very quickly. So some final thoughts here. So for updates, if you haven't liked our hospital Facebook page, do it now. That is the way that we get a lot of information out. So that's Facebook and Twitter. Our social media accounts will be providing updates as frequently as possible. Hand washing and social distancing. It's very important that everyone continues to do that. There's lots of information out there on how to properly wash your hands and how to practice social distancing. So we're advocating that as well. And then just a shout out of thank you to our staff. They have done an amazing job as this virus continues to progress through the communities. We have had no blips in service. Our staff are coming into work every day, doing what they do, and we're super proud of them. We also want to thank the town of Norwood, Norwood Public Health. They've been a great partner with us, and we're going to continue to work together to get through this. Thank you.